The clinical examination of the head, neck and chest in cattle. So for the head examination, look at the nares. Check the patency, the breathing rhythm and the odour, and see the nasal discharge quality. See if it's serous, mucus, purulent, epitaxis or has feed particles. For dehydration, check if there's N ophthalmos, which means sunken eyes, an increased capillary refill time, and also check the oral mucous membranes. It's important to note that the skin tent or skin sugar test does not work in cattle because their skin is too loose. And also check their lymph nodes, such as the parotid lymph node, the submandibular lymph node, the retropharyngeal lymph node, and the prescapular lymph node. In the chest examination, check the cardiac region, so the heart, by inspection, palpation, percussion, and auscultation. See if there's any thoracic injury or malformation. Check the heart rhythm. The normal heart rate of a cow is between 60 and 80 beats per minute. Check the intensity of the heart. It will increase if there's cardiac hypertrophy, exercise, or dislocation. The heart rate intensity will decrease if there's dilated cardiomyopathy or increased pleural fluid, or a thickened chest wall. The location of the heart is on the left side at the 3rd to 5th intercostal space, underneath the shoulder. In cattle, the cardiac dullness is relative. It's found on the left side at the 3rd to 4th intercostal space. And on the right side, the heartbeat is not detectable. Cardiac dullness will increase in the case of dilated cardiomyopathy, hypertrophy and dislocation, as well as pericardial effusion. In regards to the valves of the heart, the aortic valve is at the left 4th intercostal space, at the shoulder point. The mitral valve is at the 5th left intercostal space, at the sternal extremity of rib 5. And the tricuspid valve is on the right side at the 3rd intercostal space, at the sternal extremity of rib 4. You can also check the pulse by checking the jugular vein. For the respiratory system, the respiratory rate should be between 10 and 30 breaths per minute. The breaths should be calm and have an inspiratory and expiratory sounds, and it should be on the left and right side. For the trachea, palpate it and auscultate it and induce coughing. If the trachea has moist rails, it could mean there's pulmonary edema or bronchopneumonia or chronic bronchitis. If the trachea has dry rails, it could mean bronchial spasm, bronchitis, or early pneumonia. If there is crepitation, it can mean interstitial pneumonia. And if it's emphysematis, it could mean pulmonary emphysema or pneumothorax. And if there's a frictional sound, it means pericarditis.